So welcome everyone, and thank you just for taking your time to join us today out of your busy schedules. This is day one of our spring conference we called Social Isolation, Addressing the Silent Pandemic. We typically host an annual conference, but this year we contracted with somebody to host some amazing trainings for some of our aging partners. And since we didn't have any Arrowhead Area Agency on Aging specific information on that training agenda, we wanted to host a smaller conference to discuss some topics of your choice that you did through survey. And that's why we once referred to this as our mini conference. So not quite the same as we usually do, but a wonderful spring conference nonetheless. So before I briefly go into our purpose and our objectives for the day, I just wanted to introduce myself. My name is Kimberly Scanlon. I'm part of the Elder Care Development Partnership team at Arrowhead Area Agency on Aging. I use she, her, hers pronouns, and I live and work in Duluth. And I wish we had more time to go around and have you all introduce yourselves on camera and microphone, but we have a packed agenda for you. We are, however, welcoming you. Please introduce yourself through the chat function. Let us know your name. If you want, share your pronouns that you use, what organization you represent, and your location. We'd love to see the spread throughout the state, who's here, or at least through our region. That way we can still get to know each other a little better, but still stay on track for everyone who has a lot to do after this as well. So please type away, let us know who you are, and I'm going to take you real quickly through our purpose and our objectives for the day. Our purpose was to bring attention to the physical, mental, and emotional impacts of social isolation among older adults and explore how community organizations, health systems, and public health can collectively address this growing issue. We're between the 2 days, and I know not everybody signed up for both days. They were completely optional. We'll do our best to describe a little overview tomorrow for those who don't join today. So this is kind of our over-encompassing objectives. One, we'll understand how the supports provided by the Arrowhead AAA can help meet current and emerging needs for organizations and older adults and communities. Then we'll identify how needs for social connection among older adults changed amidst this pandemic. Learn from peers by sharing best practices, ideas, barriers, and successes in meeting those growing needs. And we'll also understand the difference between social isolation and loneliness. Learn about the growing needs among older adults, the effects of social isolation on physical health, and opportunities for partnerships between healthcare providers and community organizations to address the issues. So I hope you can stay on the whole time. If not, that is okay. Like I said, we have a packed agenda. We are so excited to have you here, sharing your time with us. Now that you understand a little bit about this conference, I'd like to introduce my coworker, Georgia Lane, who will next jump right in and go over some current and emerging trends. So take it away, Georgia.
Thanks, Kimberly, for that nice warm welcome. I agree with the sentiment. It's so great to see so many people on. I really wish we could be at our spring conference in person, but certainly appreciate the opportunity to talk about the issues. So I think it was actually my idea when we were, as Kimberly said, we wanted to survey folks and see what they were interested in, and social isolation came up as one of the top issues. And when we were talking about how to frame it, we thought that we needed to really provide a bit more of a context. And so I said, well, let's do kind of like an aging demographic landscape. So what's actually happening both with aging demographics, aging trends, and then as a result of the pandemic. And after I said that and started to dive into it, I really wish that I wouldn't have, because it feels like I'm trying to eat an elephant in one sitting, because there's a lot. Turns out the landscape of aging services and the changes that have happened, in addition to the growing population, is a lot. So I'm going to take a whole heck of a lot of information and try to condense it into about 10 or 15 minutes. This is just to really give you a tip of the iceberg to start thinking about things, looking at some recent publications and research that's been put out by NCOA and a number of others to talk about aging demographics. So for this audience, I think it's no surprise that we as a state are aging. So you can look, some of you may have seen this before. It is a picture of our state from faceagingmn.org, where it shows the percentage of adults 65 and older by county. So you can see that back in 2015, we had approximately, anywhere from 21 to, actually Aiken County was at 35% or more of adults 65 and older. And most of the state turns from kind of bluish brownish to more red. Some more local data you can see here, if I can figure out how to advance my slides. By county, this was 2020 data. 6 of the 7 counties in our region in 2020 have more older adults, 65 and older, than we do children 18 and under. So it's fairly significant in terms of our aging demographics. You can see our rural counties like Aiken County and Cook County have approximately 1 in 3 people are 65 and older. And with the exception of Carleton County having fewer adults 65 and older than people 18 and under. Oops. So I'm going to share a whole bunch of information. Here's a few supporting documents that kind of highlight aging trends that are happening. What I found to be one of the most interesting things was information. NCOA started to do a quarterly survey starting in April of 2020, so right after the pandemic hit. And they looked at the needs of older adults, and consistently the highest priority needs have been for older adults to stay socially connected. So that is in alignment with what we were hearing in our region. Folks wanted to hear about social isolation, and that is just such a huge need, not only for older adults, but for everyone during this pandemic. How do we stay socially connected? In addition to affording basic expenses and getting help with technology and transportation. Interestingly enough, in January, a new need was identified with the vaccine getting out. About over half of older adults surveyed wanted information about vaccines and also reliable information about the pandemic. So in response, the aging network providers, the community-based organizations serving older adults, were surveyed as well. And there's been a shift for them. Organizations are playing a very important role. Many of you are part of those organizations of a national network that are providing education about the benefits of vaccines. And then over 1 in 3 community-based organizations are helping people actually register for the vaccines. So that's a huge shift in what aging network providers have done in the past. We also found that demand for services were high. So 48%, so almost half of the organizations surveyed reported that they're serving more older adults than they did in January than in the fall of 2020. And then, of course, we know that older adults continue to need access to technology, with 66% of organizations saying that they needed additional funding to meet the challenge. So a lot to unpack there. This is a nice graph that shows really the high priority needs. Really interesting there. You look at that bottom one, staying socially connected. At the beginning of the pandemic, 62%, which is still a high percentage, said that they needed help staying socially connected. But now, after January, that has been kind of came to the top for the highest priority needs. You'll also note on there the help with technology. When the pandemic hit, there was only 38% that were requesting help with technology, and now that's up to 68%. So really fascinating information there. You know, right at the start of the pandemic, I think the highest need for all older adults was accessing masks, gloves, and cleaning supplies. So gosh, how much has changed within a year. We will send these slides out, and there are links to these research articles as well if you're interested in learning more about it. Another important piece to think about related to COVID is the ageism that has occurred and has been really spotlighted as a result of the pandemic. There's a great article that was put out by Sage Publications about ageism and COVID-19, and it really talks about and frames what the vulnerability narrative is. And so when we talked about the pandemic, we often used vulnerable and older adults consistently together. And so in people's minds, those two terms sort of became synonymous. So it perpetuated these stereotypes that being old means that you're incompetent. It means that you're vulnerable. It means that you need help. It means that you're not able to make decisions for yourself. A lot of things kind of came into the public conversation around older adults. And it also suggested that only old people were susceptible to the virus, and they were the most vulnerable, and that young people were resilient, or were resilient and were not susceptible to the virus. And another thing with COVID and ageism was the devalued perceived social status. So it really shed light on the discrepancy between the value placed on older adults and value placed on younger adults. There was a really unfortunately viral meme that was called the boomer remover, which the COVID was referred to. You heard a lot, certain governors in certain states were very vocal about keeping the economy going, and that the grandparents could be sacrificed so that the economy could continue to go. So it was really devaluing to many older adults. Their ageist expressions that older lives are expendable, which was set against the benefit of reduced economic burden on younger generations. And so that's just kind of the tip of the iceberg. I'm sure many folks have a lot of other examples. I think regionally thinking about how do we make access to vaccines age-friendly, and really not thinking about the needs of older adults when we're thinking about technology and getting information out there is just another, I guess, local example. So I am going to try to go through some of this information fairly quickly. This was some work that was put forth. We did some work this winter and spring with Collective Action Lab around how the Area Agency on Aging might respond to communities and to changing needs of older adults. And we framed it in sort of the environmental trends that are impacting older adults and providers. And again, this information is taken on my previous slide around kind of the references that some of the larger statewide work that's been done around trends and aging. So this is not necessarily specific to COVID, but certainly everything relates to COVID now because that's just the world that we're living in. But so, one of the primary trends, which we already talked about, is our just sheer aging demographic shifts. As I mentioned, 2020 marked the year when the number of older adults 65 and older exceeds the number of children 18 and under. And this represents actually a gold mine of resources. Creativity and experience that we have to tap for the health of our state. So that's a paradigm shift in thinking about older adults as assets versus older adults as liabilities. In addition, the populations of older people of color and American Indians is expected to grow. And with this growth, there will be a rise in the number of people needing long-term support and services. So this gives us the opportunity and the challenge to tackle health disparities by building capacity of culturally specific providers that meet the cultural needs of older adults. Not only that, we need to think about and bring into our daily conversation what is our inherent role in upholding racist beliefs and systems. And in order to meet those cultural needs, we really have to start with us, kind of how systems of power have perpetuated throughout millennia, and what can we do now to start to address some of those disparities. Another kind of emerging or need or overall landscape is thinking about consumer needs and preferences. So we want to think about older adults as a diverse group of individuals with unique sets of unique needs and preferences. So the diversity of experiencing aging is as diverse as experiencing life itself. People are different, come from all different walks of life, and we can't group older adults into one category. We need to shift from a moral claim of doing right by and serving older adults to thinking about how do we emphasize their participation, contribution, and inclusion, and disrupting the us versus them binary that permits a paternalistic stance towards older people. Oops, did that go weird for you guys? Well, that's fun, isn't it? There we go. Is that better? Okay, great. Housing, huge topic lately. AARP research shows that 87% of older adults want to remain living in their own homes, but they need supports in order to do that. Some data shows that 63% of rural homes, which is a lot of our region, were built back before 1980, and much of the housing stock dates back to the earliest 20th century. So we really have an issue with housing if we're thinking about topics that we need to pay attention to in order to meet the needs of older adults, is to think about our housing policies, thinking about how do we have a spectrum of affordable housing? Do we have the right zoning in place that assures adequate supply? Have we looked into systems for home modifications and maintenance that allows for universal design? And then what creative solutions are out there in terms of co-housing, accessory dwelling units, or other ways that we can meet the housing needs for older adults? Workforce, definitely another hot topic. In 2016, 20% of the jobs in Minnesota were held by workers 55 and older. So we need to think about how do we continue to engage boomers in the workforce. They're a gold mine of people in their prime in thinking, creativity, and resourcefulness. So there's fascinating research that's been done around COVID and how when older adults, particularly women, get out of the workforce, it takes them way longer to try to get back into the workforce, and just a lot of challenges around that. And so we don't want to disengage the older adults from our workforce. And also a great question around why does work need to be an all or nothing experience? How do we help people phase into retirement and maybe phase out of the workforce? How do we encourage older adults to be actively engaged in community life and have appropriate opportunities for residents to work for and pay for their volunteers or skills? So I was recently talking to somebody about age-friendly community work, and the comment was made about a group of people who were on a board for a historical society, and most of them were in their 80s. And one woman just started to say, well, I think I'm too old to start doing this. And they said, well, are you getting, do you enjoy it? Or do you have, reasons why you don't? And she just had this own internalized view of, no, I'm too old to be doing this. But they were able to overcome that, noting that, those values are needed. She's contributing. It's meaningful for her. It's meaningful for the community. But it's just interesting to think about how those internalized ageism perceptions come out. And that's really something we all need to actively work to address. Certainly transportation, a community with robust transportation system will help community members to age well. It's critical, transportation needs vary in communities, but it's critical that a transportation system be reliable, efficient, and consider transportation needs of driving and non-driving older people. So we don't just want to think about public transportation. We want to think about things like volunteer drivers and walkability, bikeability, things like that. Lots of information. We could do an entire seminar on transportation needs and issues. Caregiver supports and services. So we really think about expanding the infrastructure for caregivers. There's a lot of talk right now with federal legislation around what that infrastructure could look like, and actually including long-term services and supports and caregivers into some of that. I don't think it's been ironed out, not even close yet on the federal level, but just framing, if we don't care for our caregivers, it is a crisis situation. They're vital. Informal caregivers, family and friends are vital for supporting older adults. Nearly 1 in 3 of the general population provides care for an older adult or someone living with an illness or disability. Recent estimates indicate that the value of unpaid caregiving has now reached $522 billion annually. So that's a really important facet of our society that we need to think about. Another, sort of, this is more on our systems level too. I did mention President Biden's plan. He has proposed a $400 billion plan to expand Medicaid's home and community-based services for people receiving long-term supports and services. It definitely has policymakers and opinion leaders talking about how we care for frail older adults and younger people with disabilities. I think in terms of aging network and federal discussions, we haven't really been on the map in the way that we are now. And if you start to look at silver linings for the pandemic, certainly bringing the issues faced by older adults to light has been maybe one of those silver linings. And there's actually those discussions. So, however, we need policy changes and funding to shift to a greater emphasis on home and community-based services so that people can live in their home and communities as long as possible. So it's doing the stuff that we're doing, but building capacity and building our infrastructure to care for those as our aging population will just continue to grow. And then last but not least, this is what we're here to talk about today, is social isolation and mental health. I'm not going to go too much into it, but certainly the needs of older adults during the pandemic has shifted from food and supplies to staying socially connected. Really fascinating research come out by AARP that says prolonged isolation has a profound negative effect on health, as much as smoking 15 cigarettes a day. So I think we really need to look at social isolation as we said today, it's the silent pandemic, and think about how we address it. Very quickly, we had in 2020, we have had an unprecedented opportunity to access funding through the Federal CARES Act and other legislation on coronavirus relief that actually doubled the amount of money that we granted out. And we will give all of the credit to the wonderful home and community-based services providers that were responsive, that were able to apply for the funding, and that were able to get the services in the place for communities that needed it the most. So you'll see typically under our federal Older Americans Act dollars, which Kristen's going to kind of outline that, we granted about 1.3, but in 2020, we had an additional $1.37 million that we granted out. So that is no small feat. And then this is a slide that you can look at later. The blue is like our typical Older Americans Act dollars, and the orange is all of the CARES relief funding that was granted out. Quick note on what we did for Cedar Linkage Line, our direct services in 2020. Certainly, we don't want to leave that out in terms of what the Area Agency on Aging has provided. And then as a last bit, wait, there's more. We anticipate that we will have additional funding coming through, both through federal and state legislation, as well as some carryover dollars. And we really want to partner with you, to partner with innovative projects. And we're doing our best to think about the strings that are attached to these dollars, but then how can we really get the money into the hands of the community members that need it the most? So we have fabulous grant managers and AAA staff that are able to brainstorm with you and think about how that might work. So with that, I am actually going to hand it over to Kirsten Cruikshank, who's going to do a little bit more of a brief overview of the structure of our aging network.
Okay, so brief is the key word here. So most of you so I'm Kirsten Cruikshank, and I work on grants management along with Rebecca Sash with the Area Agency on Aging. I also work under the Elder Care Development Partnership Project, so which I like being able to wear both hats and make linkages between both. So I'll talk more about that later, but just to do the overview of the aging network, when we use the terms aging network, we're talking about this little visual graph here that kind of outlines that it all starts at the federal level with Department of Health and Human Services, and funds flow through the Administration for Community Living, which we refer to as ACL. They flow through to the states in Minnesota. They go to the Minnesota Board on Aging, and then to the area agencies on aging throughout the state. And as you know, we have the 7-county Arrowhead region, and the area agencies on aging, provide multiple roles, but the ones I'm referring to right now are the grant funding. And then it flows to the regional home and community-based service providers. So when we refer to the Aging Network, this is what we're talking about, but we also, especially during the pandemic, we appreciate the efforts of all the aging service providers, whether we're funding them or not. And as Georgia said, there are going to be new opportunities for funding, which will flow to our existing partners as well as potential new partners. So if you have ideas of how to serve people 60 and over in our region, please feel free to contact us, and we will be getting more details about the funding in the next couple months. We depend on these layers, above us for the timing of the funding, but we're happy to make it easy for our grantees in the region so that you can do the work that you do best and serve people 60 and over. And at this point, I am going to hand it over to Brenda, that's going to talk a little bit more about our agency.
Hi there. My name is Brenda Schaefer-Pellening. Most of you guys know me. I'm also part of the EDP team with Kirsten and with Kimberly Scanlon. I'm just going to kind of go through some of the information about how our work is guided. As you may know, our work here at the Quad A is guided by a number of factors. The first of those being the Minnesota Board on Aging's state plan, which helps us to craft the focus for the area plan for our region. Next. The first goal is to leverage the expertise and energy of older Minnesotans, I should say, both by facilitating connections to community and by ensuring that they're included in the overall workforce strategy for the region. Next. The second goal focuses on empowering older adults to make informed decisions and choices impacting their own health. Third goal centers on supporting caregivers in their caregiving journey through consultation, skill building, respite, and working caregiver resources. The fourth goal is to encourage a wide variety of housing and support options for older adults. The fifth goal deals primarily with the Office of the Ombudsman for Long-Term Care and ensuring that long-term care residents' rights are protected. And our work is also shaped in part by the statewide initiatives that come down from the Minnesota Board on Aging, including ones like this, including those targeting ageism, as well as serving older Native Americans. Click through to the last. Thank you. Our work under the Elder Care Development Partnership Program grant is largely guided through the gaps analysis process, which is undertaken periodically by the Minnesota Department of Human Services and